Hi, my name is Lauren. Today I'll be sharing a little bit about my experience as an intern at Desert Hand and Physical Therapy in Phoenix, Arizona, where I gained applicable knowledge and skills that I could take with me into a career of occupational therapy. So I chose this facility because I liked that it started as a small family-owned business and now has several locations across the state of Arizona. I worked with a physical therapist, an occupational therapist, and a physical therapist assistant. I was able to observe them both or observe them all and see which career would be more suitable for me personally. So, hand therapy is a branch of occupational therapy that involves the treatment of the upper extremity from the shoulder girdle to the fingertip. Injuries and conditions that can be improved through functional strengthening activities, dexterity and motion restoration, education on the condition and how to manage it, scar and edema management, and it also focuses on the affected joints, bones, muscles, and connective tissue and or nerves that were attacked during their condition. So prior to my internship, I listed 8 learning goals that hopefully I would have met all of them had I been able to finish. But to outline the ways that hand therapy can improve the quality of daily living, it's a great way to, it's a great way to improve motion, strength, and mobility. It is an alternative to surgery. It can reduce a patient's dependency on pain medication, and it is a way to manage pain and sensitivity in the affected area. The second learning goal kind of ties into that first one, knowing the expected physiological and psychological outcomes of the treatment. And then through patient interaction, I was able to gain insight on the diagnoses, impairments, and disabilities. Through one-on-one talking with them, they were willing and enthusiastic about sharing how they were injured or about their condition. With most of the patients, I was able to observe and assist with the tests, specifically measuring the severity and type of the dysfunction injury. More so observe, not so much assist with at that point that I had stopped. And then learn how to perform the benchmarks, which should always include measuring range of motion, strength, using a hand grip and pinch dynamometer, sensation, edema, and scarring. And lastly, I was able to familiarize myself with the therapeutic equipment and materials that were used in the rehabilitation clinic setting. So some of those equipment and tools that I was able to use are these that I shown pictures of: the nut and bolt, assembly box, the mini massager, hydrocollider, hot packs, fluido therapy box, paraffin wax bath. These all in some way would loosen the muscle tissue and increase the blood flow to the muscle so that it is easier to manipulate and easier for the patient to decrease the pain level in the patient. So for example, this is the paraffin wax bath that I tried out. You've probably seen it in like a spa. It's you put your hand in it and it just kind of warms up the muscles and loosens the muscle tissue. So here's an example of that. So yeah, you can see that the wax has hardened, and you can even use that. They can take it home and use that as like a kind of like a stress ball to strengthen the tiny muscles in the hands. Pretty cool. So after the patient is finished with their mobility exercises, they can move on to strengthening equipment. We don't want to move them too quickly in case they re-injure themselves or we push them too far. So this is some of the strengthening equipment that will work with them. The simulator, you can see that they use the pinching and the different grips to simulate different actions and work the little muscles in the hand. Same thing with the therapy. There's different levels to them, different densities, and then regular weights, and then this is like rubber bands, so it helps strengthen all the little muscles in the hand. So some of my anecdotal experience came from just observing different patients one-on-one and comparing the different injuries and seeing how different people respond. And one of those responses is different pain tolerances. So I'm just going to read what I wrote down. Something I noticed was that the difference in how patients responded to treatment. Two patients, patient A and patient B, were prescribed hand therapy after sustaining injuries from accidents at work. Patient A's thumb was crushed by an operating truck from the IP joint to the tip of the thumb, and he ended up suffering a distal phalanx fracture, a subungual hematoma, and a laceration to the nail bed. So the tip of his thumb had been lacerated and had to be surgically reattached. Then there was patient B, who had his second digit amputated by a mattress cutting machine, which I have kind of used an illustration here to look. This is like pretty much exactly what his hand looked like. It was amputated by the distal phalanx by a mattress cutting machine, and the third digit had a pin sticking through it because it was severely lacerated. His thumb was very sensitive. He also had phantom pains in his amputated second digit. Even though it wasn't there, he still felt pains or sensations coming from where his finger used to be. So that metal rod was, or that steel pin was sticking through both his PIP and DIP joints. Just hadn't been receiving treatment for as long as patient A had. Patient B had still progressed at a much quicker rate and had a much more positive reaction to the treatment. So before long, patient B was able to use that therapy that I showed earlier and use his fingers and just kind of increase the sensitivity or decrease the sensitivity and decrease the pain. And he was able to grip and pinch the putty, and that was really helping to strengthen and lower the sensitivity in his finger. Whereas patient A was still having trouble gripping little things, and his thumb was really sensitive. So whenever he touched something, he would like wince in pain. So after talking to patient A, I heard him say that he had watched his thumb like literally get crushed by the operating truck, and he watched it break. And so I think he was kind of psychologically traumatized from that, and that was inhibiting his ability to progress because he kept thinking about it. So after he wouldn't look at himself do the exercises, it was a lot easier for him to perform the exercises and improve. So yeah, outlining those two stories is a perfect example of how several factors can play a role, whether uncontrollable or controllable. They can make a difference in how a patient progresses in their treatment. And these factors can be psychological, physical, emotional, environmental. So we always have to take every little thing into consideration and to be able to find more effective ways that they can manage their pain uniquely. My second experience was with a woman we'll call V. My interest in hand therapy actually grew after speaking with her a little bit more one-on-one. She was a 63-year-old patient who had a condition called clenched fist syndrome. Basically, she had clenched her hand was so tightly bound that her fingernails were digging into her skin, and that it was like causing hygienic issues. After asking her like what was the cause of this syndrome, she said, "Oh, just over time, gradually my fingers became more flexed." I was like, "Oh, okay." And then after she left, the physical therapist asked me, "What did she tell me?" And I told her what she told me, or I told him what she told me, and he said, "Well, that's actually a psychosomatic condition. Basically, whatever happened to her was so traumatic and so stressful that she couldn't get over it, and she basically balled her hand in a fist as a coping mechanism." And it was probably, what I recall from earlier, was she had some personal issues with medical conditions, but she wasn't revealing any of that during the evaluation. So if I were still gaining hours in my internship, my next step would be assisting with the initial evaluation of patients, conducting the range of motion tests, strength testing, sensory testing, and all of that we write down in the SOAP notes. And in summary, in addition to my current task, I would also begin performing different treatments, such as applying a TENS unit or ultrasound therapy to the patients while they prepare for their exercises. So here's my log. You can see that I only got only a few days done, but I've gained so much insight from this opportunity. I learned a lot about the relationships between patients and therapists and amongst the therapists themselves, and just the level of patience and dedication that it takes to succeed in a specialized branch such as hand therapy. Thank you.